쌍꺼풀은 사이즈는 어떻게 생각하세요?
최대한 자연스럽게.
최대한 자연스럽게 지금이 제일 자연스럽죠.
But based on my experience, I decided to choose incisional one because I want more permanent results.
How do you feel?
I feel good.
Really?
Just a little bit.
Wow, so fresh. No stitches. I rest for 3 days.
3 days? 3 days only?
3
Enough?
days only.
Okay.
That's enough.
I didn't push you to work again, right?
Yeah, of course. Hi, my name is Mandy. I'm from Hong Kong, and I come here, Korea, to have 1 year working holiday. And I start working here in Docfinder like 6 months ago. Fortunately, I can have this chance to have my double eyelid surgery in 345 hospital because I accompany with a lot of patients here, and I feel like the environment of this clinic is very make people feel comfortable, and I love the nurse and doctors here, even the consultants. They are very nice and super kind. And the most important thing is that I have like a Hong Kong patient before, and her eyes are just like mine. She had the double eyelid surgery by Dr. Song. I saw the results, the final results of her, and I think, wow, that's amazing because her double eyelids are just very natural, and I want the double eyelids just like her. So that's why I want to have surgery, and I have confidence with the clinic and surgeons. I want like in our line and just natural, don't have to be like so dramatic. We are going to take like blood test.
지방이 없는 사람은 없는데 지금은 지방이 많은 분은 아니에요. 살이 좀 처져 있고 눈이 좀 돌출합니다. 쌍꺼풀은 사이즈는 어떻게 생각하세요?
최대한 자연스럽게.
최대한 자연스럽게 지금이 제일 자연스럽죠. 좀 작게 원한다는 건가요, 조금?
그 사진이
사이즈.
보여지고 괜찮아요.
눈 사진은 그게 필요 없어요. 제가 보여준 게 거의 결과에 그대로거든요. 그걸
네.
보고 본인이 결정을 해요. 이거 다른 사람 사진을 갖고 와봤자 그 사람 모양이 될 수도 없고 실물을 보고 하는 게 제일 좋아요.
네.
제가 거의 수술한 결과를 95% 이상 보여드릴 수가 있거든요.
네.
그래서 감아보시고 나볼까요? 정말 이렇게 똑같이 나와요. 그래서 그걸 보고 나랑 결정을 하는 게 제일 좋아요.
괜찮아요.
감아보시고.
Dr. Song said my skin is not too thick and I have not much fat on my upper eyelids. So he suggests I can choose like non-incisional one or the incisional one. It's like 50-50. But based on my experience, I decided to choose incisional one because I want more permanent results. I trust Dr. Song, and I know he is good at doing the double eyelid surgeries, and I know he will do my eyes perfect. Now we are in front of the surgery room, and my surgery starts soon. We'll see you later. Bye.
Feel?
I feel good.
Really?
Just a little bit dizzy.
No pain?
No pain.
They caught us so fast. Sounds like your surgery was finished so fast.
Hi, today
Today is the second day of my double eyelid surgeries, and my eyes are very swollen today. My upper eyelids are very tight and strong, and I feel very heavy when I open and close my eyes, but I don't feel pain at all. Hopefully I can feel better tomorrow. See you tomorrow. Hi! Today is the third day after double eyelid surgery. My eyes are still very swollen, but I don't feel any pain or itchy or discomfort because I keep using saline to clean the stitches area every day. Hi! Today is the fourth day after double eyelid surgery. My eyes are still very swollen today, but I keep disinfecting the stitches area every day, so it is clean and no inflammation. So at the first 3 days, I had ice pad for the swollen. From today, I can use warm pad for faster blood circulation and also for the swollen. Hi, today is the 6th day after my double eyelid surgery. Today I don't feel any pain or discomfort. I just have some bruising problem. And tomorrow I can go back to the hospital for removal of stitches. So far I love the line and the shape. I think the doctor makes it very even. So it's super nice. I'm very excited and look forward to the final results.
Did you feel pain?
A bit, just a little.
Just a bit.
Just a
When
bit.
she
Remove the stitches. Wow, so fresh. No stitches. The nurse removed my stitches and I just saw the doctor. The doctor said the surgery is very successful and my eyes are very even. And then I can come here again next month. Hi everyone, it has been 2 weeks after my double eyelid surgery. My eyes look less swollen, but I still have a bit bruising here on the upper eyelid. I think maybe next week my bruising will go away. The level of the eyelid is perfect now. So I like it. Bye bye. See you after 2 weeks on the final checkup date.
아침에는 조금 부었다가 저녁에 좀 빠졌다가 이럴 거예요. 지금 살짝 부어 있는 상태인 것 같은데 보통 3개월 정도 되면 그게 좋아질 겁니다. 지금 상태는 아주 안정적으로 좋고 흉터는 시간이 조금 더 지나면 조금 더 좋아질 거예요. 일단은 각질이 지금 많아요. 이제 오기를 좀 씻더라도 조심해서 씻잖아요. 이제는 열심히 이제 좀 잘 깨끗하게 닦아내세요. 그러면 각질이 좀 떨어져 나갈 거예요. 네. 너무 막 빡빡하진 말고 그냥 세수할 때 평소처럼 그냥 하면 돼요.
네네.
또 궁금하신 거?
없어요.
좋습니다. 잘 됐습니다.
Hi, this is Leah from Docfinderkorea. I'm with Mandy today.
Hi, I'm Mandy from Hong Kong and I also work at Docfinderkorea. It has been 1 month since my double eyelid surgery has done in 345 clinic.
How do you feel about your incision site now?
I feel very good because I barely can see the scar right now. So I think the doctor did a great job.
I remember it was like several months ago when you told me you wanted to have double eyelid surgery.
Yes.
Yeah, but can you tell me why you finally decided to have the surgery?
Because I want to have double eyelid and for easier makeup. Because whenever I draw my eyeline, it will be erased.
Yeah, you
easily.
showed me. And it was hidden, right?
Yes, yes. So I decided to have double eyelid surgery to have like beautiful crease and beautiful eyes.
After the surgery, how long did it take for you before getting back to work and your daily life?
I rest for 3 days.
3 days. 3
days.
days
Just
only?
3
Enough?
days only. Yeah,
Okay.
that's enough.
I didn't push you to work again, right?
Of course.
So you chose 345. It's your clinic, and you chose Dr. Song for your surgery. Overall, what do you think about them, the clinic and the doctor?
So first of all, I love the clinic's environment. They are very clean and bright, and it makes me feel comfortable. And the staff are very nice. They take care of me, give me strict and clear instruction that what should I do before surgery and after surgery. So for Dr. Song, I very appreciate his honesty. Yeah, because during consultation, he was really, really honest and very patient. And he explained everything to me. So I feel very comfortable and trust this clinic and the doctor.
True. Yeah, Dr. Song, he's always honest. And sometimes too honest, but usually the patients love it. What do you feel about the result right now?
Right now, it has been 1 month. I love the level of my double eyelid, and I feel like the line is really good, and both of my eyes are very balanced. But you can still see my swelling because it just has been 1 month after surgery. This is not the final result, so I will wait for like at least 3 months to see the final result.
Okay. Well, I know some people, they still feel like double eyelid surgery or incisional double eyelid surgery is kind of risky, and it's still like it's too invasive or it's just too much. What do you think? Like, do you feel this is a risky surgery?
Honestly, I didn't feel like it's risky at all. As long as you choose a good doctor and good clinic, it's very safe. And you can see it's just after surgery, it was just a tiny scar. So I don't think it's risky.
What do you think about the scarring now?
I can barely see my scar right now, but I do ask the doctor, can I apply the scar cream to erase my scar? But the doctor said that there is no need to apply any scar cream on the double eyelids. So I think it will fade away after a few months.
Sure. As someone from Hong Kong, can you tell me why did you choose Korea for your surgery?
Honestly, I do not have any knowledge about Hong Kong's surgery clinic, and I work at Docfinderkorea. I went to lots of clinics and had consultation with my patients, and I gained like confidence during the whole process. I feel like the doctors are very professional and the surgery process is very safe. So I decided to have my double eyelid surgery in Korea.
Okay.
Everyone, it's me now. So 3 months have been passed since my double eyelid surgery. I love my eyes level so much. It's so natural. I can do my makeup and wash my face without any problems now. I really want to give a big thanks to Dr. Song and the Clinic 345. And their staff are very nice to me. Also, I want to thank you, Docfinderkorea and Leah, for communicating with clinics. Yeah, thank you all.
Thank you. Bye.